Friends, I am Dr. Amdekar. In the last 6 videos, my colleagues discussed various aspects of clinical evaluation of localized swelling. In the first video of the series, Dr. Chokani discussed about the abdominal localized swelling, and he made an emphasis that at times the patient presents with a mass in the abdomen, a swelling in the abdomen, but at other times the patient may present with either an abdominal pain or vomiting, and the doctor may find the swelling. It's important to be sure that it's not an extra abdominal mass, but once you are sure it's an intra-abdominal swelling, then certainly you look at the site of the swelling. That tells you from which organ it's likely to be arising, and that's not very difficult. However, sometimes the swelling is not restricted to any particular quadrant and is large enough, and it could arise from the retroperitoneal, renal or an adrenal mass, and at times it's a large periumbilical swelling which could arise from the lymph nodes itself. Having localized the tumor, one could look at the consistency, and most of them are either firm to hard, and as hard as a tumor in the liver, a hepatoblastoma could be. It is a localized tumor in the right lobe of the liver and often totally asymptomatic and may present even in a small infant, presenting as a mass in the abdomen. Of course, most of the other tumors are firm to even hard, especially like a malignant tumors, but at times they may be cystic, soft swelling like a mesenteric cyst, or maybe an ovarian cyst, or at times a colorectal cyst. In the subsequent next video, Dr. Kharit discussed about a thyroid swelling evaluation. And he made a point to begin with that you must differentiate it from thyroglossal cyst, which moves, of course, with deglutition like a thyroid swelling, but also moves with movements of the tongue. Once you are sure it's a thyroid-related swelling, then it could be a localized swelling unilateral on one side, and it could be really a malignant or a benign tumor. But at other times, more commonly, it could be a generalized thyromegaly, and that generalized thyromegaly could be either due to iodine deficiency or many enzymatic deficiencies that lead to a thyromegaly, and of course a typical thyroid swelling at puberty, which could be just physiological. And once you have a thyroid swelling, then you are bound to differentiate between whether the thyroid functions are normal or whether there are any subtle clues to hypothyroidism or hyperthyroidism. After this, the next video, Dr. Palni Raman talked about the scrotal swelling, and besides the benign swelling like hydrocele or sometimes the hernias, etc., and of course a very localized swelling like benign or malignant tumors, he emphasized largely on an acute painful scrotal swelling, and he made a strong emphasis that it's an emergency which may be due to acute torsion testis or maybe an acute epididymitis, but occasionally it could be just the torsion of the appendix of the testis. And he made a small difference between the two, and he said in an acute torsion testis, the testis is pulled up and a cremasteric reflex is negative, absent. On the other hand, if it's only the appendix of the testis that has undergone torsion, then the testis lies at its normal site and there is a bluish dot at the top of the testis, and this suggests that it could be not a total testicular torsion but just the appendix of the testis. And all the same, he emphasized it's a pediatric emergency and often you need a surgical exploration to save the testis from becoming gangrenous. Thereafter, in the next video, largely came Dr. Anjali Kokana to discuss breast swelling. And she said that breast swelling could be often physiological, like in an early neonate in the first few days because of the transfer of the maternal hormones, and then of course at puberty, at pregnancy, at a premenstrual phase, and so on and so forth. Having said that, There could be gynecomastia as a normal physiological phenomena, but it could also be due to organic disorders. Of course, if you have a localized swelling in the breast, then it could be a fibroadenoma or even a malignant tumor coming up, and that is important to differentiate between all this. Constitutional symptoms, the age of presentation, a progress of the lesion, all that makes you guess reasonably well what's the cause of a localized breast swelling. Thereafter, Dr. Sridhar Ganpati discussed about the bony swellings. And the bony swellings could often be either at the epiphyseal end, coming from the cartilage. They are often chronic, slowly progressive. They are often at multiple sites, as in the case of rickets or chondrodystrophy, and they present hardly with just the swelling, but multiple other defects in the bones, and that's not very difficult to make out. But the swelling could be right in the diaphyseal area. It's small swelling but much more pain, as it is the situation with a trauma fracture or maybe even an osteomyelitis, acute osteomyelitis, infective osteomyelitis, where other constitutional symptoms, fever, etc., and at times even an autoimmune encephalitis, which could be less painful, often recurrent, often benign, and here the pain is the much more important major feature than a localized swelling. But of course, there could be swellings of the bone, like again a benign or a malignant tumors, and one must be very careful about diagnosing the cause of that. Often there could be secondaries coming from primaries, like from a neuroblastoma, a skull nodule, or maybe in an adult a prostatic carcinoma, and so on and so forth. In the last of the series, Dr. Tushar Maniar discussed how to evaluate a joint swelling. And of course, he first made it very clear that you must differentiate between articular and periarticular swelling, and that's not very difficult because the periarticular swelling is tender, both like articular swelling, but the movements are restricted only at the end of the movement, and the passive movements are not painful. Whereas in a typical arthritis, the movements are painful and throughout, active and passive both. Once you develop clearly whether it's an articular swelling, then you want to know whether it's an acute painful swelling, like an acute septic arthritis or maybe traumatic synovitis, and occasionally gout, but gout is not common in children, often seen in adults, and there they are painful acute swellings. However, chronic swellings are more often seen also in hemophilia, which could be acute, but often a long-term repeated hemophilic joint will present as a chronic arthritis, and also often rheumatological disorders. These issues are discussed largely in relation to the other associated symptoms and signs, and it's not very difficult, but to label a definitive diagnosis of a chronic arthritis may not be easy to begin with, but some time needs to be elapsed before you can label it accordingly. Well, friends, this was all the series about the clinical evaluation and my summing up of important messages of that all my colleagues gave. In the next series, we are going to talk about the clinical evaluation of different functions that often patients present with. I hope you continue to join our YouTube and you are enjoying it. Thank you very much.